Welcome back, my guys. Let's continue with our topic of discussion, whereby we are going to discuss about complications, or what will happen if pelvic inflammatory disease is left untreated, or what will happen when this kind of a disease is not managed at the right time and in the right way. Let me start by thanking you guys for the 1,000+ subscribers. I'm not taking it for granted. Guys, feel appreciated, and let's continue sharing this content to as much people as possible, and I know our channel is going to grow bigger and bigger. So let's get back to our point of discussion. What will happen if this pelvic inflammatory disease is left untreated, or if it's not managed? Untreated pelvic inflammatory disease can lead to what we call scar tissue and pockets infected fluid. This is what we call an abscess. Like in the case of what we call a boil always has some pus inside it. So that is an example of an abscess. So that is what will happen if pelvic inflammatory disease is left untreated. It can be that serious, and you always know when there is pus or an abscess, that is something which might be so serious. So when this disease is left untreated, it can lead to the following. One, what we call an ectopic pregnancy. What is an ectopic pregnancy? For those who understand well the female reproductive organs, after fertilization, or when a male sperm meets a female ovum in the fallopian tubes, the implantation, or after they met, they go back and implant in what we call the uterus. But when you have a pelvic inflammatory disease, this may hinder or may prevent the fertilized egg from coming back to the uterus, and this makes it grow into the fallopian tubes. And everybody of us knows we can't allow a pregnancy to continue in a fallopian tube. So because that tube is so small, there is no space for that embryo or the fetus to grow in the tube. So after realization, or when you diagnose a patient is having an ectopic pregnancy, surgery is always indicated and that thing removed. Number two, we have infertility. How does infertility come about? These bacteria enter everywhere in the reproductive system of let's say the female reproductive organs. So when they go to the ovum, or to the ova, which produces the ovum, which in return meets with the sperm to make an embryo or to form a baby. So when the ova is affected by this disease, it won't be in a position to produce the ovum, and this can lead to, actually it can lead to a permanent infertility or inability to conceive or have a kid. Next, we have a chronic pelvic pain. When untreated, pelvic inflammatory disease can make one live a life full of pain around the pelvic region. Obviously, because of the abscess, as we have discussed, because an abscess is always very, very, very painful. Next, we have what we call tubo-ovarian abscess. What is tubo-ovarian abscess? This is whereby there is a collection of pus in your reproductive system, hence affecting fallopian tubes and ovaries. I hope you get that point. So how can we prevent somebody or a patient from getting pelvic inflammatory disease. I think, guys, we started by discussing about sexually transmitted infections or urinary tract infections, and they are the major causes of pelvic inflammatory disease. So it's so obvious. Or if you practice all the points we discussed during our discussion of urinary tract infection, it's so obvious you will have prevented yourself from getting a pelvic inflammatory disease. So some of these practices which can prevent this kind of a disease include: one, practicing self sex. This is, for example, use of condoms. Next is what we call request your partner to get tested, for example, for a urinary tract infection, and get treated. So if you get tested and get treated, for example, you get treated for urinary tract infection, obviously you have avoided this kind of a disease. Next, we have what we call, especially these is mostly to ladies. Avoid what we call dodging, and I know most of you know about dodging. Dodging affects one of the bacteria which is found in the vagina, which we always call nomoflora. What is a nomoflora? A nomoflora is a bacteria found in a female reproductive organ or the vagina, and its work, it's called nomoflora because it lives in your vagina, but it doesn't affect you. In fact, it provides protection for your body. Yani it prevents you from getting other bacteria. It eats or consumes other bacteria which might enter your system through the vagina. So if you dodge, all the chemicals used in dodging can kill that nomoflora, and if it's dead, obviously you will have no protection at all. Guys, that makes the end of our discussion today. You'll forgive me, I'm a bit in a place, I'm not in my usual venue, and I hope you get the information. Let's meet in the next video tomorrow. And guys, continue subscribing, sharing, and liking our videos. Let's make this channel grow bigger and bigger. Have a good evening. Thank you.